Welcome to This Week in Surgery Centers. If you're in the ASC industry, then you're in the right place. Every week, we'll start the episode off by sharing an interesting conversation we had with our featured guest, and then we'll close the episode by recapping the latest news impacting surgery centers. We're excited to share with you what we have, so let's get started and see what the industry's been up to. Hi, everyone, and welcome back to This Week in Surgery Centers. Today's a special episode, which I actually had the opportunity to record live from the New York State Association of Ambulatory Surgery Centers conference in Albany a few weeks ago. I sat down with three very special guests: a spine surgeon who built his own private practice throughout the pandemic, a veteran ASC administrator who helped transition her center from physician owned to a joint venture with a health system, and then the chief advocacy officer at ASCA. So, three very different roles within the industry, different perspectives, but one common theme throughout. And that's that policy tailwinds are, in fact, creating real growth opportunity within the ASC industry. First up, we'll talk to Dr. Daniel Choi, a board certified orthopedic spine surgeon and founder of a growing private practice on Long Island. He's expanded from a solo startup to a multi physician team across multiple locations with 10,000 plus annual visits. He's now planning an ambulatory surgery center guided by a simple question: would I send my own family here? Next, you'll hear from JoAnn Vecchio, the administrator of the Ambulatory Surgery Center of Western New York and a member of the board of directors of NISAC. For more than 25 years, she's led the center shift from ophthalmology only to a true multi-specialty center, and recently helped guide succession planning that brought on a health system partner to scale operations, protect business continuity, and preserve community access to care. Finally, I'm joined by Kara Newbury, ASCA's Chief Advocacy Officer, to discuss how a federal government shutdown could impact ASCs, potentially delaying the CMS 2026 final payment rule and other key legislation. We also talk about what leaders should prioritize right now in this moment amid so much pending change. It was energizing to have these conversations in person, and it was a great reminder that face-to-face time still matters. So today's format's a little bit different. You'll hear these interviews back to back, and then I'll pop in at the end for a quick wrap up. I hope you enjoy the episode, and here's what's going on this week in surgery centers. I'm so excited to be sitting here with Dr. Daniel Choi. We're going to chat a little bit about some future plans that he has. So tell me first, Dr. Choi, a little bit about your private practice and what you do currently.
Absolutely. So I'm Dan Choi. I'm a board certified orthopedic spinal surgeon, and I started a private practice in Long Island, New York, about 5 years ago during the COVID pandemic. And this was a pretty challenging time to start a private practice. Nobody was
For sure.
lending. I had a business plan that I shopped around. Actually, about 7 banks turned me down, even though medical practice is like a bond, right? It's very
Yeah.
safe. But at that time, they weren't lending to any startups. So
Wow.
the eighth bank was M&T Bank. And one of their tellers sent my business plan up the chain. And I was able to meet with them. They gave me a 5-year term loan. And I was able to start my practice. From a solo practice, we have now grown to 3 orthopedic spinal surgeons and 2 interventional pain management physiatrists. We also have a nurse practitioner, a physician assistant. We have now 2 locations and are growing to 4 this year with over 10,000 patient visits last year. So we're really serving a need in the marketplace. Right now, there's a lot of heavy consolidation in healthcare, we know, in all marketplaces. And there is a big demand for private practice, believe it or not. Even
Mhm.
though we see less and less private practitioners, patients seem to be seeking out the private practices that are left. And I think private practice, we can be more agile, we can move quicker. If patients are demanding it, we can meet those demands much quicker. So that's why I think our practice is growing.
That's fantastic. And I understand that you're going to be expanding even more into the ambulatory surgery center space. So tell
That
me a little bit about that.
absolutely, that's our hope. We are currently in the planning stages of this right now. I would say that, and I've written about this on various social media platforms, that we have a crisis looming in this country. And I think the one of the biggest crises in healthcare is our physician shortage. What you're seeing across 50 states is young physicians. Now, the opportunities for employment are all with corporate healthcare systems, right? It's either hospital systems or it's private equity or it's actually insurers. United Healthcare is actually the biggest employer of physicians in this country. 12% of physicians are employed by Optum. And Optum, many don't even know, is actually owned, it's a subsidiary United Health Group. With all this employment, what once was a profession where you had total control over your delivery system, your work environment, the employees you hired, and how your patient care got delivered, that's now been controlled by corporate healthcare. And so
Mhm.
you see physicians in that type of environment, they've lost their autonomy. And I don't think to their fault, it's just the way that legislation and the healthcare system has been shaped. It's been driven towards consolidation. And because of that, physicians are burning out earlier. There's a lot of early retirement. There's physicians who, trained for 10 years, got to a place where they get to practice now. And they're saying, oh my gosh, this is not what I envisioned. And they're looking to get out. So there's actually physicians who are trying side gigs. Like instead of your practice being your main source of
Wow.
income, now there's a physician group called Physician Side Gigs on Facebook that has over like 20,000 members. And these physicians are looking for other ways to supplement their income and potentially off ramp and get out of the practice of medicine. And there's a
Yeah.
ton of discussion about this. This is a really sad thing for really our patients
Yeah.
because the patients are losing out on a ton of expertise. I mean, the amount of experience and training a board certified physician has to get to that point, we're talking about immense resources. The
Absolutely.
education system, we're talking about from high school level, pre med, college, med school, then residency. I mean, the amount of man hours that takes to train a surgeon or a primary care physician is immense, and they're quietly exiting the
Mm.
workplace. And so I think that staying independent as a private practice is critical to alleviating that physician shortage. And I would say that the ambulatory surgical center is one of the key ways that I've discovered that private practices across the country have stayed viable.
Yeah.
Because what we hear about is that professional fees have always been going down. And you see Medicare rate cuts to professional fees to physicians constantly every year getting cut, whereas facility fees are actually either staying neutral or they're going up thanks to the lobbying of American Hospital Association and big entities that are keeping those facility fees buoyed. I think that private practices that have actually jumped on to starting the ambulatory surgical centers have stayed autonomous, stayed financially viable. That's
Hmm.
critical. And then the working environment actually becomes one that is more physician centric, in my opinion. And
Absolutely.
unfortunately, the hardest part about my week as a private practice doctor is actually stepping foot in a hospital. Look, the hospitals are great. They do a lot of things really well, complex care, ICU care, emergency room, trauma centers. But some of this stuff that we're doing in hospitals, like basic elective surgical care, doesn't need to be done in a 1,200 square foot OR. They can be done in a 500, 400 square foot OR in an
Right.
ambulatory setting. They're usually being discharged the same day. And that's the niche of the ASC to get these basic bread and butter cases in and out with higher quality, better safety metrics. You're not doing your case in a hospital where there's a life threatening infection just next door. There's so many advantages to the ambulatory surgical center that I think are going to provide a lot of value to the patients and also to the physicians. And I think that the ASC is very key to potentially alleviating the physician burnout where physicians are not just operating in an outpatient setting that they like, but they get to operate in their cases. Surgeons get to do their cases in a setting that's very physician centric and driven. The ASC model is their customer is a surgeon, right? They want to
Absolutely.
drive cases to their center. So they're making sure that every part of that experience for the surgeon is very seamless and smooth. And that's why I think it's the future.
Absolutely. I could not agree more. And we talk about this a lot, especially when it comes to anesthesiologists and the
Mhm.
shortage there. How can we convince more anesthesiologists to come and potentially work at an ASC? How are you thinking about anesthesia? Is that something that you've given a lot of thought to, how to approach that?
Sure. We're in the planning stages. We've definitely thought about different options in the
Yeah.
marketplace. How are we going to do it? Are we going to have an independent practice come in and staff the
Right.
center? They bill for themselves. Are we going to bring it in house? Are we going to use different groups? We're playing around with different models. I would say that for me, the highest priority is patient safety,
Sure.
quality, and making sure that we have great anesthesiologists that I feel really confident just bringing. I think my metric for any decision I make for my center is what can I do to ensure that if my family member, I
Yeah.
was going to send them to this center, what would I want being done for my own family member? And I actually operate my private practice with that framing for every decision that I make. And that's served us well. A reputation for quality, safe care has really grown in the community. And we want this center to be the exact same way. So, we're leaning towards utilizing a private practice that I trust, that I've already worked with. I know they're phenomenal. I would want my family to get taken care of them and bringing them in to be a part of our center. They would operate independently and they would be responsible for staffing and they would do all the billing. Obviously, they would reap the financial rewards of being very reliable and staffing our center all the time.
Yeah, that's great. That makes perfect sense. I have another question related to kind of some of the legislative changes
Sure.
in New York. So, a lot's happening,
Mhm.
and there's been a lot that's been talked about that's finally starting to be pushed forward. Do you see that as being an opportunity for your ASC, other ASCs? How do you think that's going to kind of shift the healthcare landscape in the
Yeah.
state of New York?
No, absolutely. So I think that everything going on politically and in healthcare in general is that healthcare, I believe the spend now nationally, it's about 20% of our GDP.
Yeah.
That's absolutely mind boggling. And actually, hospital systems are now the biggest employer in every state. In every metro, you go to anywhere, Cleveland Clinic, they're the biggest employer. You go to Texas and all the big cities, they have a big major hospital system. In New York, where I'm at, it's Northwell. Northwell is one of the biggest employers in the state. Healthcare is such an economic driver and the spend is so large. And I think that what we've gotten to unfortunately, with some of the legislation that was written all the way back to the Affordable Care Act in
Hmm.
2010 is that we have driven healthcare to be bigger and bigger. Healthcare consolidation, right? We want these all these tiny little hospitals to all get into one big system. We want it all the insurers. There's only two or three big insurance payers in every marketplace. So there are good things that can be done with big corporate entities. There's a lot that can be accomplished. Maybe you think it's more efficient. The capital deployment is more efficient because you have big sums of money that you can deploy. But there's also a lot of inefficiencies that come with consolidation. And if you think about just the free market, why do we have such a robust free market in America? You have anyone who thinks that, if they can run a business that can meet the marketplace demands, you don't have to be Starbucks to run a coffee shop, right?
That's
You
right.
can come in there and through your own sweat and hard work, build a cafe that is so much nicer and so much better and the coffee is so much tastier than Starbucks. You know this in your local marketplace. And in healthcare, that is just not happening anymore. Doctors can't come out of training and feel like they can open up shop and open up a private practice that can serve the needs of their community. And so what happens in any marketplace, and history has repeated this over and over, just basic economics 101, is that if you lose competition, prices increase,
Mm.
right? If you can't increase the supply, if people are not competing to try to capture the market and they're not working hard to be more lean, more efficient, or higher quality, then the prices go up. You have fewer
That's
people
right.
that don't need to compete. And that's what's happened in American healthcare. You just see the competition cratering. So you've seen prices go up. You've seen health insurance premiums every year, 20% hike, 20%
That's right.
hike. Families are now paying 24 to $30,000 a year in premiums. This is pre-tax dollars that could be going to their families. Instead, employers are also pitching in where their share of what they're, and you see this actually today, right now with the government shutdown,
Yeah.
all the buzz now is talking about what is the government paying for in healthcare and why is the government subsidizing these premiums? Why have the premium? And then everyone's starting to ask these questions like, how crazy is it that we're paying 24 to $30,000 a
Yeah.
family in healthcare premiums? So, and this all comes back to why is the ASC so critical in today's environment? Because
Mm.
ASC has been proven time after time to bring down costs because it is introducing competition to the marketplace. It is another place that the big entities that do surgery now have to compete with. They have to try to be just as good as the ASC or better
Yeah.
or start their own ASCs to retain those cases. And when you introduce competition, prices will come down and the
Right.
healthcare spend will be more manageable, hopefully. That's
For
why I
sure.
see that this is an economic no brainer that this is the future, unless, again, in America, we have a lot of regulatory capture, a lot of lobbying interests that go in and convince our policymakers that what is obviously correct is wrong and what is totally wrong is the right way to go. And
Exactly.
we have these backward laws that have produced the mess that we have today. So we just hope that common sense will prevail and we can continue to introduce more competition to the marketplace through ASCs.
I love that. And hopefully, the Medicare final rule that we'll hear about soon will continue to reinforce that procedures should be moving into these lower cost, higher quality outcome environments. And there will be even more momentum.
Absolutely.
Well, fantastic. I am so excited that you stopped by to chat. Thank you so much. I wish
Absolutely.
you the best of luck as you're building out your surgery center. And I can't wait to talk to you then when you open it.
Thank you so much.
Well, thank you so much, JoAnn, for joining me. I know it's a busy day here at the conference, but I would love to just chat with you about your work and what you do. If you could give me a quick introduction. that'd be
Sure.
great.
Sure. My name is JoAnn Vecchio. I have been in the ASC industry for about 25 years. I am the administrator at the Ambulatory Surgery Center, Western New York, which is in Amherst, New York, which is very close to Buffalo, New York. We are one of the largest ASCs. We were one of the first ASCs in our Western New York area. We have quite a few in the Western New York area, but we are one that's been in existence since 1999. We've been around a long time, multi-specialty. We still do pediatric cases at our surgery center, and we see on average probably between maybe 15,000 upwards of 29,000 patients a year.
That's awesome. And you
Mhm.
have been with the ASC of Western New York for
Yes.
25
Yes.
years. So tell me about that. The industry's changed a lot and
Yes.
evolved a lot. How has
Yes.
things shifted in that
You
time?
know, the industry has changed a lot. We started at the ASC with a single specialty. It started with a bunch of ophthalmologists that tried to get out of the hospital for access reasons. We were seeing at that time, back in 1999, so many ophthalmology only centers starting with ophthalmology. And then I think it was somewhere around 2002 or 2003, we started to break into other specialties, seeing that ophthalmology was great, but there was room for growth in the industry. And some of the regulatory things made it a little bit easier at that time to expand services. And, to get the multi-specialty licensure in the state of New York at that time was a different process, obviously. While things evolve, we're constantly looking to expand services in ASCs. And, I think one of the good things of all the people that are here at this conference are we're always striving to work together to try to expand the services that we are able to offer through safety and efficacy, and can they be done. And being fortunate enough to have the state organization behind us and listening to the members to say, hey, listen, we're thinking we could maybe do these at the ASCs. Let's work together to see what we could do from a legislative point of view to help us get these, maybe recognized a little bit. So we're very fortunate. At first, in a million years, you would have never thought you would be doing a total joint in an ambulatory center. You never thought in a million years you would be taking care of a pediatric patient that was under the age of 10 at an ASC. But we do it, all of us do it all the time and very safely, and, with a very high level of throughput, with quality outcomes and patient satisfaction. I mean, parents love to bring their kids to an ASC more so than a hospital, depending on what they need done. And the same thing with our adult patients. So we're seeing that expansion happen more and more now.
Yeah.
First, it was, the ENT and the orthopedics with the total joints. You're seeing plastic surgery, a lot of bigger plastic surgery cases being done in ASCs where before they would be in hospital with the bigger mastopexies. And some of these mommy makeovers that you're seeing now that are really popular are being done in ASCs. And then they're longer cases. So those are happening. And now we're on the precipice in this state of hopefully adding cardiology procedures to ASCs,
Yeah.
which I think just brings a platform of growth to the community, not just to the ambulatory centers, but there's benefits here for hospital-owned physician practices to expand and to be able to recruit into an area of New York that you're able to see your patients and have access to a hospital system and to an ASC. I think those are things that are on the forefront for the ambulatory centers that I think are going to be great.
Yeah, that's fantastic. There's so much exciting growth
So
on the
much.
horizon.
Yes.
And you've had some changes at your ASC in the last few
Absolutely.
years. So
Absolutely.
tell me a little bit about now what it's like working with the health system.
So we were a freestanding, physician-only owned ambulatory center, started in 1999 by just a group of ophthalmologists that grew into a multi-specialty surgery center. I'd say right before COVID, We were planning, doing our succession planning, and we kind of took a look at the list and said, hey, listen, guys, how are we going to do this? How are we going to keep this place open? We're all fighting time here, but there is going to come a point in time where we need to make some decisions on how you want to move forward. And in order to perpetuate the business, it was decided amongst the group to go out and find a partner. And we were very, very lucky and very fortunate to find a really great fit within the Catholic Health Organization in Western New York. They have been an outstanding partner for us, coming in to support us from a regulatory point of view. When you are looking at this from an ambulatory site, you have this small group of people that you are relying on, and you may have to call in consultants or work with other sites that you may or may not be able to work with. But being able to partner with a larger organization that is a health system, not just a hospital, but a health system, it opened up access for us to be able to tap into resources that we never had before, between regulatory readiness and compliance and physician education, all of the things that were shortcomings for our center. It's just because we didn't have access to them, and now looking at the changes that we are making, because we are early on in the relationship, but the changes that we're making are so beneficial to not just to the owners, but to our staff and to our business line. I think that this is just a home run, and we're so fortunate to be able to work with them every day, on whatever it is, patient satisfaction and quality metrics, key performance indicators, all the things that before were so siloed to just our site. Now the benchmarking is there. We can see what others are doing, and we have the support. And so I have to say been a positive experience. It really is good for this business, I think, as we move forward, to be able to lean in on a larger health system.
Really the best of both worlds. You get
Yes,
all of the access to the scale that you didn't have before, but you can
absolutely.
maintain all of the benefits of working in an ambulatory surgery
Absolutely.
center setting.
Absolutely. We're very fortunate that we are able to keep some of the autonomy. So we work very closely with the contract negotiations, and we look at what is more beneficial for us and for the system. And we're able to kind of work together so that it's a win for us. So very fortunate.
That's great.
Yes.
That's great news. And let me just ask you this. What are you most excited about as you look ahead to all the changes on the horizon,
Oh,
cardiac coming into New York, the legislative change? What gets you excited about the
so
industry?
many things get me excited in looking down the road. There's a lot of challenges that we're going to be facing in order to get there, but I think that the cardiac is a big thing. I think maintaining a program of excellence for the outpatient total joint procedures, as well as being able to maintain the Medicaid population in granting access, additional access, an alternative site of service to the patients in the population of Western New York, to be able to come to our center and know that it's safe and know that they have a place to come that's outside of the hospital. And now potentially being able to offer cardiac procedures, I think is just going to be, just going to be turn the whole thing upside down, because we are now able to offer these services, whereas they may have been limited before, or people may have been waiting before, and that's a proven thing with like the pediatrics and the ENT.
Yeah.
Very
People
fortunate.
may just not be getting those procedures through to
Exactly.
access. Yeah.
Exactly. And, being that it's an ambulatory center, we do have the flexibility of, being able to add cases on late in the day. And, the physician satisfaction, the surgeon satisfaction is there to be able to get the patients taken care of on the same day as they, if they have a fracture and they need to get in right away, or something's going on. We're very fortunate to be able to offer that. That's very exciting.
It's fantastic. Well, I'm so glad that you stopped by. I'm so impressed by the
Absolutely.
advocacy work that the board of the association has
Thank you.
been doing. I mean,
Thank
it's
you.
just a really phenomenal example, I think, for other state associations to see how, when the community comes together, that you can
Absolutely.
really affect change in the state.
I agree. And, we're very fortunate at the board level and from the state association level to have such a diverse group. While we're all pulling in the same direction, there are different ownership models. Some are private equity, some are hospital owned, some are still freestanding. It's good to understand that we have everybody's point of view and everybody's voice is heard. It was nice to meet you, and thank you for having me. We
Thanks
enjoyed
for
the rest of the
joining me.
conference.
Well, hello, Kara. Thank you so much for taking a few minutes to join me. I am excited to get to chat with you a little bit about what's going on at the federal level. You oversee all things legislative and regulatory for ASCA. So there's some stuff going on. Fill me in.
Yeah. So as of this recording, we are in a federal government shutdown. And so while that hopefully is not impacting access to care at this time, it could impact some things. Our federal payment roll is set to come out in early November. That could potentially be delayed. Surveys could be delayed. The big picture also is the fact that legislation, both positive and negative, outside of just funding the government, is probably not being considered right now. One of the big pieces of legislation that ASCA has been advocating for is a Medicare beneficiary patient responsibility bill. Right now, hospital outpatient departments have a cap on what the Medicare beneficiary would pay. It's right now 1676, and there's no such cap in the ASC. So if your Medicare beneficiaries are paying more out of pocket than 1676 to have a procedure done in your ASC, they're paying more than going to an HOPD, which is counterintuitive, but that's what's happening right now. So we are trying to get a similar cap to what the hospital outpatient departments have. So that's a big piece of legislation we're proactively pursuing. There are a couple other bills that we have concerns with that we're pushing back against. So there's a piece of legislation that's been introduced in the Senate geared toward site neutrality. And I know on its face, a lot of ASCs think this sounds great and, that they're going to get reimbursed what hospital outpatient departments get reimbursed. And that might be the case, but it would be because HOPDs would come down to us. There's no discussions of increasing rates because the federal government is trying to save money. It's all about going to the lowest common denominator. So we have concerns about that. And then physician offices are also part of that. And so for some codes, it might negatively impact ASCs and drop us to the physician rate. So we're keeping a close eye on those site neutral discussions and legislation that's been introduced. And then just price transparency is another big topic on the Hill. While we agree with transparency in general, and of course want our patients to know how much they're going to have to pay to come to an ASC, what's being considered is really far beyond that. It's, negotiated rates, it's standard charges, it's the very specific rates that have been negotiated with payers. So we have a lot of concerns about that. And we don't think that it would benefit the patients or the public ultimately. So, like I said, not probably likely that it's going to pass anytime soon because they're focused on trying to figure out how to fund the government. Right. But those are some of the things that we're really keeping our eye on at the federal level. And just one other thing I kind of want to note, because it came down last month, there is a new CMS prior authorization demonstration project. We're in New York right now. New York is one of the states impacted. There are 10 states and it's for 41 codes, primarily cosmetic, but there are some ophthalmic codes that are impacted. And it would basically require facilities to go through a new prior authorization request. Okay. And although it says it's technically not mandatory, our sense is that if you don't do the prior auth request, chances are you'd be denied, and then you have less recourse trying to get paid for those codes. That's slated to go into effect December 15th. We're writing a letter to CMS asking for a delay. We thought we needed more time anyway. And then with the shutdown and, less resources, we think that it makes sense for that to be delayed. So we're optimistic that hopefully we can see a delay with that prior auth demonstration. But, considering the federal government is shut down right now, there still is, a lot that we're working on, a lot going on.
Is there anything that ASC administrators, leaders should be focusing on or thinking about at this current moment?
I mean, I know that ASC administrators have so much on their plate, so much that they're worrying about and thinking about. I think that top of mind, we've got issues with anesthesia and the cost of anesthesia. And, so we're tracking all that at the federal level and trying to help our facilities through different means. But I think that just keeping up with ASCA and your state association and knowing what's going on. I know that you all do a great job with these webinars as well, the podcasts, but just trying to, stay up to date because things are coming down the line that will impact them, whether or not they're paying attention. But and people can always reach out to me if they have any questions.
Oh, that's wonderful. We're so grateful for the work that ASCA does and for the work that you do.
Thank
Thanks,
you.
Kara. Thank you so much for joining us live from the NISAC conference in Albany. Three conversations and one common theme, and that's that ambulatory continues to prove its value and policy momentum is opening up a real opportunity for growth. From Dr. Dan Choi, we heard what independent medicine can look like at its best. He built a private practice during the toughest moment, scaled it to multiple locations and 10,000 plus annual visits, and is now planning his own ambulatory surgery center. His North Star of delivering patient care he'd want for his own family ultimately anchors the case for ASCs. Better access, strong safety, lower cost, and a physician centric environment, which in turn benefits patients. From JoAnn Vecchio, we got the long view of smart evolution. Over 25 years, her center moved from ophthalmology only to a true multi specialty, then executed succession planning that ultimately brought in a health system partner, adding scale, resources, and benchmarking while retaining the agility that the ASC provides. She's bullish on what's next in New York, including cardiology and preserving access for Medicaid patients. From Kara Newbury at ASCA, we get insight into what the impact of a prolonged government shutdown could be on the ASC industry. We expect policy timelines to shift. Think the CMS payment rule for 2026, but there are other things in the mix, including a cap on Medicare beneficiary cost sharing at ASCs, site neutral proposals, which could push reimbursement rates down for everyone across the board, and of course, ongoing broader price transparency efforts. But the bottom line here on the policy and legislative front is stay close to ASCA and stay close to your state associations for the latest news and updates. So, a big thanks again to my three guests and to you for listening, as always. I hope you enjoyed this episode. And if you did, please leave us a rating or a review on your favorite podcast platform to help others find us. We really appreciate you being here, and we'll see you again next time.